Hello, everyone. I'm Gabby Garces, a Zone General Manager for Henry Schein, and I'm happy to be joined today by three past presidents of the American Student Dental Association. With me, I have Dr. Roopali Kulkarni, faculty at the University of Pennsylvania School of Dental Medicine, Dr. Craig McKenzie, resident at the University of Pittsburg in the Department of Dental Anesthesiology, and Dr. Sydney Shapiro, pediatric dentist at the York-Presbyterian, Columbia University. I'm thrilled to be sharing the virtual stage with you three today. During the panel discussion, we're going to be exploring some of the high-level issues and trends we're seeing today as it relates to the prevention of oral disease and the promotion of oral health. We have a powerful opportunity today to create actionable conversations as we deal with the many consequences the pandemic has brought. I know you're all passionate about this topic, and you each are helping to advance oral health and access to care in your respective specialties. To get us started, perhaps you can each share one of the challenges you're seeing facing the dental profession today. Let's start with hearing some thoughts from Roopali.
Thank you so much. So as an educator myself, it's one of my goals to truly empower the next generation of dentists to feel comfortable treating patients from all backgrounds. As an oral medicine specialist, it's part of my scope of practice to work with people with disabilities. And in seeing our aging population, we've noted an increase in chronic diseases. And so as our patients present with chronic diseases, or there's a rise in treating patients with people with disabilities, I think access to care in a sense of treating patients that might not be able to seek care in a traditional dental setting is a huge challenge, not only in our dental facility, but in the communities that we serve. So my goal in being faculty, even in our people with disabilities clinic, is to empower dental students and future generations of dentists to be able to work with patients from all different backgrounds.
Thank you for sharing your thoughts. Craig, I'll toss it to you to add.
Yeah, I think one of the biggest challenges, kind of to echo what Roopali was saying, is finding a facility or finding a dental home for a lot of these special needs patients that are unable to cooperate for dental treatment, whether they want to or not, as well as for young children that are also not at the age yet where they really know what's going on at the dentist. So within my field of dental anesthesiology, we provide more access to that by going to the patient at their dental home, providing those sedation services so that they're able to get the oral health care that they truly need right there at their home. And I know here at the University of Pittsburgh, we've been able to provide that access to a lot of these special needs patients and pediatric patients, but patients are driving so far to receive these services. So hopefully we're able to expand that so that patients aren't having to drive so far to find that care.
That really is a good point. Finding children their dental home by age 1 is really a critical need, right? As we get started within the opportunity to create better oral health for our youth. Sydney, anything to add on your end?
I do. Tying into what Roopali and Craig said about access to care, and something that we as new dentists and past ASDA presidents are very passionate about, is the amount of student debt that recent graduates have and how that indirectly affects access to care. When dental students are graduating with extreme amounts of student loans, their postgraduate opportunities can be limited. They might not always go to areas with dental practice shortages, hospitals, academia, because of their debt burden. It's something that ASDA has been advocating for a very long time. Student debt reform is one of our main advocacy initiatives. And so I think that that's something that the dental profession is it's a challenge that we are facing right now, and something that ASDA has been working on to help alleviate.
That's a really good point, Sydney. I do agree with that. Debt and the passion to go and serve, and some of the consequences that unfortunately student debt has. Where is the dental association from here? What have we done already with debt, the awareness of debt within dental students?
So I can talk about from the last 2 years, perhaps, as I've been president and immediate past president, and then I can have Roopali and Craig chime in as well. But working with legislators over the last 2 years when COVID hit and students were not in school, having before the interest rates were paused, reaching out to legislators about student loans and pausing the interest rates And then, hopefully as we move forward out of the pandemic, being able to support students through the transition back to interest rates and payments being started.
The ADA, the American Dental Association, and ASDA at our joint lobby day each year have always included some sort of student loan refinancing or the ability to consolidate federal loans at a lower interest rate, which currently isn't possible. I think something else we really need to look into is the ability for graduate students, including dental students, to be able to take out those subsidized loans, similar to how undergrads are able to take out those subsidized Stanford loans. There are loans in the marketplace currently that could help with the student debt burden, but they're unfortunately not available to graduate and professional students.
In addition to the tangible actions in terms of changing legislation or working with external organizations, I think one of the things that ASDA has come to at the forefront is also educating students on non-traditional paths and what opportunities there are available in terms of scholarships or loan repayment programs, so that you may be able to pursue a career in public health or academics, or perhaps serve in the military. And I think as we allow students to learn more about those opportunities and create spaces where students may be able to apply for those, I think that could also alleviate some of the debt burden, as well as encourage students to address some of these pieces of access to care.
From the different opportunities that each of you have raised your hand for when it comes to public service and the opportunity to be a part of the public health education, what are one or two of the biggest positives that you believe you've become a better dental professional because of this type of service that you've been a part of?
Well, for me personally, I pursued a dual degree and got my master's of public health while I was in dental school. And then I chose to pursue oral medicine as a specialty. And the interdisciplinary nature of care is something that is truly rewarding. I think we learn a lot more about how the oral health of your body is truly connected to your systemic health. And in order to understand what impact you can make in public health, at least for me, I had to remember that I was on a team of people providing care to someone. And in thinking about patient-centered care, I think sometimes we can become insular. So I always say in dentistry, we're working in the millimeter, but in public health, we're working in the landscape. And I think it's a very nice dichotomy that has allowed me to connect with my patients on a more personal level, although my education has brought me to that population level health.
Thank you, Roopali. Sydney.
Absolutely. Like Roopali, I also pursued my MPH during dental school. And so I feel the same way, the interdisciplinary care, realizing that you're part of a bigger team, and also realizing that when your patient comes to your office, it's not just those 45 minutes that are affecting their oral health. There's so much more to their story and to the barriers that they're facing, what got them there today, how you can help as an educator. Roopali is very passionate about education, and so is Craig. And I think that we all, in addition to educating peers, colleagues, students, every day we're educating our patients. And that's something that is so powerful, that we can give them that opportunity to take the time to teach them about oral health and how it relates to their overall health, and be there as a support for them.
Thank you, Sydney. Craig?
Yeah, and I mean, to kind of change the conversation slightly. My master's isn't in public health, but rather in education, just to be the odd one out there. But education still is a public service, and it's all about preparing the next generation of dentists. You have 3 future specialists, or I guess 2 future specialists, and Roopali, who is a specialist on this call. But it's the general dentists at the end of the day that are caring for all of these patients. And it's our job as educators to ensure that they're equipped with the skills to work with those special needs patients, to work with those young kids, so that access to care can occur wherever and not just in these specialty care centers. So I think a lot of it is about educating the future generations so that they feel empowered and feel confident in being able to treat all patient populations.
Well, your collective passion for public health and education is definitely a big part of this, right? We have to be able to inspire and educate the future in this capacity. And thank you for doing that in each of your responsibilities that you have. So how can we collectively help educate patients and society overall? And I mean collectively as a dental industry, not just dental professionals or dentists, us in the organizations that we serve in dental industry, as well as all society as a whole. How can we continue to educate oral health?
It starts with removing the silo that dentistry has historically been put in, separate from medicine. So much can be accomplished when we work together with all aspects of healthcare, particularly as a pediatric dental resident. I see this with pediatricians. They see young patients several times in the first year of their life, and working with them to educate new parents on why and when they should bring their child to the dentist. Like you said before, the importance of the 1-year dental visit is something that they have a major role in. And, working together to educate them, to educate our patients, and educate society as a whole is incredibly important. And doing so, it doesn't just rely on dentists. It takes many people in healthcare to integrate us into a more beneficial society and healthcare.
Yeah, Sydney, I completely agree with your thoughts as well. But from another perspective too, the 21st century, not just in dentistry, but battling the power of misinformation. And I think all of us see this in our practices in dentistry as well, whether it be, oil pulling or charcoal toothpaste or whatever that latest fad might be. Not only that it's not benefiting somebody's oral and systemic health, but actually that some of these fads on the internet are actually causing patient harm. So I think a lot of that is our responsibility as dentists to provide that education, but it's also on the partners of dentistry, Henry Schein and other consumer organizations, to provide that education as well, and make sure that the products out in the marketplace for consumers, for our patients, are ones that benefit them in everyday life.
That's so funny you talk about dental fads. All of my friends, because I'm in dental, they automatically assume that I can give actual clinical advice. And they're like, what's this latest like charcoal whitening kit and toothpaste that I should try? I'm like, just go to the dentist. I can't give you any information like this. Like, the best person to advise you on what to do with your oral health is your dentist. Go see them. They will make that recommendation. So it happens. It's so easy to get stuck in, all the social media, Instagram stuff that gets pushed to all of us. So it's important to steer clear of those dental fads. Roopali, anything else to add?
I think it's so interesting when Sydney and Craig were speaking, I said, I resonate with what they're saying so much. And I have this little phrase I always say that they're aware of, because I love alliteration. And I always say, educate, engage, and empower. And I think, as Sydney mentioned, part of the education doesn't just come from how we educate our patients or how we educate, perhaps our staff, but it's really how we work with our medical colleagues as well, that we are one piece of the puzzle. And like I said, when we focus on that patient-centered care, a big part of it is thinking, how are we contributing to someone's overall health? And then when I think about engage, I think a lot of it is how that information is disseminated. So yes, in our social media world, our world full of technology, I think we can actually leverage the fact that globalization has made our world smaller so that we can promote healthy habits and actually initiate campaigns to talk about how you can better your own oral health. And then to empower. So at the end of the day, the goal of that is to allow individuals to feel comfortable with, taking care of themselves, or perhaps taking care of someone, if they're a caretaker for a person with a disability. How can they learn that information? So I sort of see it as a progression, and it's almost a little combination of what Craig and Sydney were saying that really resonated with me.
Thank you. That's great. There are many dimensions to access to care, both in dental care and the wider healthcare services. People with disabilities face a particular range of barriers that can prevent them from accessing appropriate care. What are some of the misconceptions about treating this population that you'd like to see change? I'll toss it over to Craig to start the conversation.
I think one of the bigger misconceptions is that they have to go see a specialist, or they have to be in some advanced care center, or be seen at a surgery center, for example. But The truth is general dentists have the skill set needed to treat these patients, and either on their own with additional CE and special needs that I know is definitely being offered now across the country, or in partnership with someone like a dentist anesthesiologist. They're equipped to see these patients right at home in their office. And it's a great way to expand their practice. It's a great way to serve the community. And at the end of the day, it's honestly the right thing to do so that these patients don't have to drive 2 hours to a specialized care center. So I think the message to drive home is you can do it at your dental home, back at your practice.
Yeah, especially with the advancement of technology, Craig, as you mentioned.
Absolutely.
It's incredible the things, the technology that we've been seeing just in a short couple of years in dentistry as a whole. So, Roopali.
I think one of the misconceptions is that all disabilities are the same and that we don't know how to treat them. And it's interesting. So being, like I said, a faculty member in our People with Disabilities clinic, one of the teaching moments I've been able to share with my students is that having a conversation with someone can go very far. Creating a comfortable space for someone and explaining what you're doing, even if they might not be able to respond back, you never know what someone is understanding or gaining if you take a moment to educate them on what you're doing. And I think, even just with technology, simple things like lowering the lights or playing calming music can help patients feel more comfortable in the chair. And the more the exposure they have, the more likely they are to come back. So I think it's about, number one, admitting when you don't have all the information and understanding and knowing that not all disabilities are the same, but two, being willing to even try simple things, just that simple conversation of, let's try this. Let's see how you do with this. I'm going to use my mirror just to take a look. Breaking it down into those simple steps can actually make a big difference.
I think going off of what Roopali said, one of the misconceptions is the time that it takes in an appointment. And Roopali touched on a lot of techniques that make it more comfortable for a patient with special health care needs in the dental chair. And, they might need to come in for a couple more appointments to desensitize them to the dental office. And that does typically take more time, but the misconception is related to, how much time that is. The challenges related to the complex medical needs of each patient. And I think listening to Craig and Roopali and thinking about the complexities, the way to address those misconceptions are through education. I know we've been talking a lot about that, but that goes for education for dentists. CODA in 2020 added the requirement for treating patients with special health care needs for predoctoral students. So that was a huge step just recently. And whether it's training the dental staff at the office, parents, when they come in your door, how can you make this more comfortable for them and their child? I'm saying parents because I'm used to treating patients who are pediatric patients, but patients in general, caregivers. I think that addressing those misconceptions through education is the most important thing that we can do, whether it's as dentists, healthcare professionals, Henry Schein, in general.
Is there an annual course that dental professionals have to take in this type of education, right? And with people with disabilities and being able to treat them in the best way possible? Is there some sort of a course that annually dentists have to take, or team members?
So it's currently not a requirement for special needs specific CE, although each state does have a CE requirement to renew your dental license. But I am pleased to see the increase in the amount of CE specifically targeted at patients with special healthcare needs. And Roopali, I know that you've been involved in that. Perhaps you can touch a little bit more on what you're doing at your school.
Yes, I think given the CODA requirements now, something that I think is striking is it's not just in terms of clinical care, but it's being introduced in the didactic curriculum as well. So understanding how, when you learn the basic sciences, how that might impact someone's medical condition, how does that really relate to what you're going to do as a dentist? And then really to further push it, certain associations like the Special Care and Dentistry Association, they have been at the forefront of promoting CE courses or creating more essentially user-friendly courses, especially for dental students as well. And so at our institution, that's something that we're promoting, not only to essentially complement what's occurring in the clinical setting, but to continue on that, whether that's through lecture series or through actually traveling and being able to interact with other healthcare professionals and how you can be a part of a team to treat people with disabilities. So it's certainly progressing and it's exciting. We're really at a turning point in the education of future professionals and how to treat people with disabilities.
Excellent, thank you.
And
Go ahead, Craig.
Sorry, I just wanted to add, I think the future for special needs patients is only going to get better. I think, I'm very lucky to be at a training center where caring for patients with special needs has been such a part of the curriculum for several years. We have a dedicated center for it. And 3rd and 4th year dental students, as well as dental hygiene students, have the opportunity to work with these patients, both under sedation as well as with just behavioral management techniques. And I think more and more schools are catching on to that, like Roopali was suggesting. And this new generation of dentists is going to have skills that past generations simply haven't been afforded through their dental education. And I think that's going to be really great for this patient population.
Awesome, thank you. Craig, you really talked a little bit about the new generation of dentists and what, quite frankly, what our responsibility is today, right? As we continue to drive the new generation of dental professionals up. Before we close out the discussion, it's really about where do we go from here, right? How do we harness conversations like these and turn them into actions? So around the horn, I'd love to hear a little bit about, what you're excited about as a dental professional with the topics that we talked about today. And what are you looking forward to not only continuing to evolve and also elevate as we move through this journey together? And how do we really take some action around the conversations that we're having here? So I'll start with Sydney.
Thank you. I'm excited for these enhancements in access to care and that it's such a topic that is heavily discussed. I'm so happy that we had the chance to discuss it here today with each other. It's something that we're all very clearly passionate about. And being in this generation of dentists, like Craig said, that we have this education afforded to us, and moving forward in our profession, we are aware of access to care issues and what is required to address them. And I think to take action, we can all say we've experienced the power of organized dentistry in using our voice to create action. So for me, I'm really looking forward to being involved in organized dentistry for the remainder of my career and having the opportunity to have that power of a collective voice to make changes in our career.
Yeah, I think what I'm really excited about is the dental professionals entering the field today are very just socially aware. They care and they want to make a difference. And I think that's important as individual practitioners, but just like Sydney said, having all of these new dentists joining in organized dentistry and using that power of the collective voice, I truly hope that our generation is the one that's able to transform and revolutionize patient care.
Thank you, Craig. Roopali.
As Craig, Sydney, and I are considered new dentists, I think one of the things we've noted throughout our time in leadership is also the changing demographics of our field and how with the globalization of our world, with advancements in technology, we've really been able to, I think, push dentistry to the next level. I think it comes down to three things for me. It's education, it's mentorship, and it's community. So I know all three of us have discussed our love of education. And for me, it's exciting to see how dental academics has been able to adapt to incorporating all of this technology or these newer advancements in treating patients who perhaps didn't have access to care before integrated into the curriculum. We're learning a lot more now, I think, than we ever have. I think the second piece of that is building genuine relationships and connections, not only within the dental community, but with other stakeholders and other organizations. And so I have been, afforded such great mentors. And I think that's really what's kept me excited and motivated. And then I think, as Sydney sort of hit the nail on the head, community is really what's going to push us forward. I think the power of organized dentistry, as well as relying not only within ourselves, but within the entire healthcare community, we're going to see changes that are truly going to better the world.
Absolutely. I agree. Absolutely. With all three of you. And it's so, again, I mentioned this earlier, how the passion that you all exhibit is a true testament to where dentistry goes, for the future. And I certainly am excited for what's to come with especially your leadership in the different roles that you currently have and you will have in the future as it comes to the dental industry. So thank you for that. This has been a great discussion. I want to thank Roopali, Craig, and Sydney for being with us here today. And thank you to everyone who listened in. Looking forward to the next one. Thanks.
Thank you.